Seniors who live in rural areas face a number of difficult challenges when it comes to accessing health care and planning surgeries compared to non-rural seniors. Rural seniors must deal with hospital closures and driving long distances to reach health care and medicine. Seniors who need surgery will require the assistance of family, friends, and even strangers who may live miles away. And after surgery, rural seniors face a host of difficulties that can make their recovery journey very challenging and even dangerous. Please join us as we show how rural seniors and their families can plan their surgeries and get the help they need to live their best possible lives after surgery. This program was partially funded through a Patient-Centered Outcomes Research Institute Eugene Washington PCORI Engagement Award and the National Grange.
So for most of us who've enjoyed living in rural communities, there are lots of benefits, but your access to services is more challenging.
Dr. Ferguson is founding dean and professor of the Emory and Henry College School of Nursing. Located in the Appalachia Highlands of Southwest Virginia, Dr. Ferguson is extremely familiar with the problems of rural seniors.
It may be that you have to drive miles and hours to get to follow-up care, whether it's your specialty appointments, whether it's picking up medications from the pharmacy, food at the grocery store. It might require a lot of travel.
Rural hospitals are closing at an unprecedented rate. Since 2005, a total of 195 rural hospitals have shut down. More than 600 rural hospitals nationwide are at risk of closing in the near future, which is 30% of all rural hospitals in the U.S. These closures mean rural seniors must often travel many miles and hours to reach any type of health care.
One of our closest friends has to drive 4 hours tomorrow to go to an eye surgeon for their children just because they don't have the specialists where they're at. We do see a lot of driving and hardships trying to get the best care for our families possible.
We are lucky right now. Our closest hospital is within 25 to 30 minutes of us. That hasn't always been the case.
Samantha and her family returned home to rural San Antonio, Texas, to become a caretaker for her aging parents.
We've had new hospitals in the recent years built closer to us. I have family members that it's over an hour or so to get to a hospital. So it definitely plays into a lot of scary times sometimes of how do we prepare for getting to a hospital, getting our healthcare needs taken care of in an emergency situation.
Another difficult problem to overcome is the independent nature of most rural residents. The proud frontier qualities that enable them to thrive in remote areas means they often find it difficult to ask for help. For the adult children of rural seniors, this means they must make an extra effort to talk to their senior parents.
The first step is well before any medical procedure or surgery. You've got to have some difficult or tough conversations with your loved ones and caretakers. The time to plan is before you face surgery and before you even talk to your healthcare provider.
When mom and dad have gotten older, we've definitely started talking to them about how they want to live and what's important to them. And it's not an easy talk. Like, you never want your parents to get old. Like, they should be young and helping us raise their grandchildren and hopefully their great-great-grandchildren.
Since conversations with independently minded seniors may be a challenge, a tip sheet or question prompt list will help guide everyone in making these vitally important decisions.
I'm Joan Smith. I'm the program manager on this effort for trying to reach rural senior citizens about their health care. Very proud to be part of this project by the National Grange because personally it affects us all.
Joan Smith and her team at the National Grange put together these tip sheets for pre- and post-surgical planning. It covers topics such as, should I have surgery? And what happens if things go wrong after surgery?
So I have done all those documents that they urge you to do, your directives, your authorization for making medical decisions for you.
The question prompt list made us start thinking about how we were going to find a place for Kathy to sleep after she has surgery, how we can get around the house, talking about how we're going to help her be more mobile, assistance with walkers or whatever she's going to need to be able to get around the house for the first few weeks. So it's good to have a prompt list and start thinking about it prior to the surgery.
A question prompt list is a really valuable tool to help remind us about the important things we want to ask that we might forget in the urgency of the moment, or the nervousness of seeing our healthcare provider, or the anxiety of even thinking about having surgery. So having the questions written out ahead of time is really important to both cover everything we want to ask, as well as prompting us to ask those questions when we have the opportunity.
Many rural residents live in areas with limited internet connectivity and even no internet access. There are non-internet ways to distribute these tip sheets.
Make copies of it and take it to your church. What about your Kiwanis Club and your Rotary? Take it to your Women's Club or your Masons. Any place that you can distribute these 2 documents that we've put together on questions to ask your surgeon, and then planning your lifespan before and after surgery. What about those county fairs or that bazaar or that dinner? You can place it right on the table when you have a local community dinner for the neighborhood to raise funds.
But I think that the questionnaire is helpful in that there are sometimes things you don't think about growing up that you have to talk to your parents about, as well as your kids about.
Dave Roberts and his family are caretakers for his 91-year-old mother, Debbie. Dave relocated his family from California to rural Connecticut to care for both his parents.
We joke with our kids that they're going to have to change our diapers like we changed their diapers, and they don't like to hear that.
The tip sheets were funded through PCORI, the Patient-Centered Outcomes Research Institute, and are available on the National Grange website.
You never want them to be old, but because we've had these conversations, I know that I'm doing what they wanted, and I don't have to second guess what I'm doing because I know this is their wish.
The question prompt list is going to be a fantastic tool for people my age and older to utilize in order to have conversations with their families to make preparations for surgery, for healthcare needs. Rural folks can be a little bit stubborn. And so sometimes tough love comes into play and say, no, this is what we've got to do. This is how it's going to be.
But I think the questionnaire is good because it's important to understand, like, who should we be talking to? What should we be focused on? What are their wishes?
The most important conversation that seniors need to have is with themselves. Modern medicine can certainly prolong life, but will this be a life that seniors want to live?
I think it's important for seniors to ask their surgeon and themselves, will this surgery offer me a better quality of life? Because for some patients, as we get older, the focus is on quality of life, not necessarily just living longer. And this is an important and very personal distinction to ask and to discuss with your doctors and your family.
The greatest thing that a patient can have going into and out of surgery or any serious condition is a close medical advocacy that would look out for the best of this person's interest. Most of us don't think about a living will, a medical power of attorney, or about asking someone close to us or someone in our family to be our medical advocate for us.
A living will is a legal document that spells out the medical treatments that you would and would not want to be used to keep you alive. It also lists your preferences for other medical decisions, such as pain management and organ donation.
Do you have somebody that will help you make your medical decisions if you are unable to communicate? This is that important document called the Advanced Healthcare Directive or a living will. Please make sure that you have your preferences communicated very clearly to the people around you, and it needs to be in writing.
Probably the hardest conversation to have with your surrogate or your patient, your advocate, your loved one, is thinking through what if things don't go as planned.
A vital part of advocating for yourself is finding a surrogate. This is a healthcare proxy, someone who can make decisions if you, as a patient, are incapacitated and unable to make decisions. This can be a family member, a loved one, or a close friend.
It is really important that you choose someone who can articulate for you, that you trust, and that you talk through the difficult decisions that might happen in terms of what your wishes are. Do you want to be on a ventilator? Do you want CPR? Do you want life-prolonging care? Or do you want comfort care to be kept clean and pain-free? If you don't plan for this and make your expectations clear before surgery, then your family will end up making a crisis decision afterwards. This might not be in your best interest, and it also increases the stress on your family member or loved ones to make decisions during a moment of crisis.
When Mom and Dad have gotten older, we've definitely started talking to them about how they want to live and what's important to them. Is it moving houses? Is it getting closer to their health care and their doctors? And what do they want that's most important to them in their next stage in life?
Shared decision-making is at the core of all the conversations that seniors and their children need to have with each other.
A big part of this is communicating with your caregivers and your family on what it is that your desires are for your future.
Shared decision-making is important so that you think through what it is that your personal preferences are for care should you not be able to communicate to your loved ones or caregiver directly.
Some of the questions that you'll need to consider: would you be willing to receive feeding through a tube, even if it's just for a short time after surgery? Or if you have trouble waking up after surgery, would you be willing to have a machine breathe for you? And if so, how long would you be willing to stay on a breathing machine? Please make sure that your family knows what your preferences are, and that's a very, very personal decision. After surgery, you're going to need a responsible adult to drive you home and to stay with you for at least a day or two. Most people would prefer that support comes from a family member. After surgery, you'll need to ask, can I prepare my own meals? Or will you need to rely on a family member to help you with your food preparation? And if you have drains or tubes or bandages after surgery, will you be able to take care of them yourself? Or will you need to have one of your family members come to help you with it? And if so, they need to be trained on how to do that safely.
Once you've had those important conversations between surgical seniors and their caretakers, the next steps are far more concrete and vital to a safe recovery from surgery.
Another question to ask is, how long will anesthesia last? Depending on the procedure, it could take days or weeks for the effects of anesthesia or paralysis to finally wear off. Will you be able to walk? Will you need a wheelchair or a walker? Should you prepare a bed in your living room or prepare to sleep on the couch on the first floor near a bathroom rather than trying to navigate the stairs? Will you need a wheelchair ramp outside? Will you need a social worker or home health care aide to help you? Will you need rehabilitation or physical therapy? Can that be done outpatient? Does that need to be done in a physical therapy office? Or does that need to happen in your own home? Or can physical therapy be provided in your home?
Study after study now, the medical community over the last decade has understood that patients' recovery is so much better at home, and they plan for it. Do you have the right resources and enough resources to stay home? Do you have help available you can call on so you can stay home?
I think we make sure that we have handrails on stairways, and I don't yet, but I really want to have those safety bars in showers and bathtubs. I think those are so important, and I just think that aids like that are necessary for older people, because you just never know when you're going to slip.
But I think we do agree that we would, just like my parents and her parents, would like to stay in our home. We'd like the home to be accessible.
One of the things we're looking at is changing homes and getting into a house where we don't have stairs to climb, which will help mitigate that. And we're very cognizant of the opportunity to fall, and so we hold on to things and use assistance as we need to.
Falls are the leading cause of death from injury among people age 65 and older. Every year, more than 3 million seniors over age 65 are treated in emergency rooms for injuries related to falling. The most common injuries due to falls are hip fractures and head injuries.
I know several people today that are in the advanced age time frame that are basically, that tell me that the biggest issue is falling. My own mother passed away just a few days after she fell and basically crumbled her hip and hip joint and pelvis.
So I've actually had a fall and actually been in the hospital because of a fall. And so it's something that everybody has to take seriously and be concerned about.
I had to think about my home. Do I have rails in my shower? I do now. I didn't when I first moved into my house in Florida, but I do now and I feel much safer there. Do I have a rail to go down from my home into the garage? I do, because I thought about it prior to this project even, but most of us don't.
Every time a senior comes into our clinic, we talk to them about how to prevent falls and are they at risk for falls, because that could be devastating to a senior for them to fall and potentially have a fracture.
Preventing falls is so important in order to be able to maintain our independence and our ability to live on our own. We're learning more and more about how best to prevent falls. And one of the big issues is looking through your home and looking for obvious trip hazards. So rugs that are not tacked down, or small scatter rugs, or thinking about, oh, I've got to hurriedly get to the bathroom, that maybe we want to have a bedside commode while you're during your recovery, so that even the bathroom is not a long trip. Looking at your bathroom is a really important piece in terms of encouraging or helping you to live independently. So considering having handrails in the shower, what are the rugs in the bathroom, avoiding slip or trip hazards. Is the floor particularly slippery if there becomes moisture on the floor? Having assistive plumbing devices so that the handles are not difficult to turn on or turn off. Having well-lit and open surface areas so that you can have your supplies or everything you need to take care of yourself with ready accessibility. I think one of the challenges if you live by yourself is to recognize when you can't do it.
Many rural seniors live alone. They may be widowed or live miles away from family and friends. Seniors who live alone without access to family and friends can reach out to state and local assistance programs to find someone who can help after their surgery.
Personally, I reached out to fellow Grangers when I had that surprise gallbladder situation in March. I asked one to come and stay with me for a time, just for 3 or 4 days after surgery, not knowing at my age if I was going to be able to get in and out of the bed on my own without assistance, up and down out of a chair, to bring the ice packs, etc.
And that's one of the hardest things for any of us to sort of recognize and admit that I need some help, and that it's really important that you think through ahead of time. It may be the best choice for you to go into an extended stay rehab center as you recover until you're strong enough to live and be able to care for yourself independently.
So for seniors that live alone and don't have nearby children or grandchildren, communicate with other Grangers in the area. They'll be glad to help you, as well as your senior citizens clubs. All those folks at your senior citizens center or in your church, many of them are in the same situation you are.
One thing you might consider getting is that many watches, including Apple Watches, have a fall detection ability, so that if you fall down, it'll ask you, are you okay? Do you need to call 911? And it will help you communicate if you're lying on the floor and can't get to the phone.
Once in a while, we all need help. Don't be afraid. You must communicate if you need help.
So it's really important for our grandparents to be around so we can have fun and help them survive and help them have really good stuff, and it's really important.
There are many resources for seniors no matter what their rural living situation. One of the oldest rural farm social organizations is the National Grange, with more than 150,000 members across 1,700 chapters in 37 states.
Grangers across this nation since 1867 have been helping each other and have been helping their communities in many, many ways. We're all strong Grange community, and you can help your own community and those in need. Ask for help and give help. That's what Grangers do.
As we get older and my husband and I prepare for, our future, that allows my kids to know, hey, this is how we're going to take care of mom and dad. And hopefully a couple of them out of the 4 are going to be willing to step right up and help take care of mom and dad as we age.
For information on the National Grange, visit nationalgrange.org. For information on services for seniors age 60 and older, contact your state unit on aging and your state's Department of Human Services. This program was partially funded through a Patient-Centered Outcomes Research Institute Eugene Washington Pecori Engagement Award.